Now I'd like to introduce Karen Cotton. And Karen is the Regional Director for Department of Health and Welfare.
Hi. As Garv said, my name is Karen, and I work for the Department of Health and Welfare. I want to know how many of you, would you raise your hand if you live in Idaho? Okay. I just wanted to see how many of people that I was talking to who I actually work for. So, and I actually work for all of you. You all pay my salary through our state contributions, you might say. So thank you for allowing me to be here and share. I must tell you that I am relatively new to this position. I've been in this position for about 3 or 4 months. So I have to refer to some notes because I don't know it quite, it isn't quite here yet. So it just flows out of my memory and recognition. So I am going to refer to some notes so I make sure I give you the right information. You're going to hear a lot of stories over the next couple days, lots of personal testimonies, as Angie just talked about and Gar mentioned, and you'll hear from other people about what it's really like to both be on the receiving end of a mentorship and being on the giving end of a mentorship. And that's very important to hear those kinds of stories that touch our heart and give us that emotional reason for doing something so important in a relationship with other people. What I want to share with you is a little bit of the hard data that goes along with that. For those of you who like numbers and percentages and data, you'll like this part. I think we need to have both. We need to be able to back that intuitive belief that we have, that need to help other people with the numbers that tell us, yes, there's really a need out there. And so that's what I want to share a little bit with you about. First of all, a little bit about the Department of Health and Welfare. Over the last year, over a course of a year, we will touch about 1 in every 4 people in Idaho. We help people get birth certificates and marriage licenses. We help people get medical care and assistance in food and housing and child care assistance. We help people with developmental disabilities get better services so they can live independently. We help some of our most vulnerable citizens, both the elderly, the disabled, and children, lead better lives through care and medical care. 2 of our biggest areas that we provide services for is in mental health services and substance abuse. And I want to give you just a little bit of data behind that. Who are we talking about? First, I'm going to start with substance abuse and some numbers. In our state, when we're looking at people who are involved in treatment for substance abuse, this is kind of a profile of what a typical person in Idaho would look like. Basically, they are 60% are men, most all are Caucasian, 36% are between the ages of 25 and 34. So it's not the youngest teenager, it's that next group up. And 26% are between the ages of 35 and 44. So we're looking at most of the people in treatment are between 25 and 45. 60% are employed or in school. I think a lot of times people think people who are in substance abuse aren't working or in school, but this shows differently. When we look at the substance that people use, 40% of adults use alcohol, while 37% use meth. When we look at adolescents, it's a little different. The drug of choice, as we say, for adolescents is marijuana in Idaho. And of 87% of youth and adolescents that are involved in state-funded treatment, the average age was 15 to 17, although we are seeing a much lowering of that age, and you'll hear about that, I'm sure, from Jeff and some of the other folks here today. While meth use in Idaho is still a relatively low percentage of people, it's on the increase. And last year in 2006, we saw an increase, 37% increase of adult usage and 18% of adult use, or use by adolescents. And that was unfortunate because we had been seeing a decline. And in 2006, we started to see the trend go back up. And so we're concerned about that. And we're wondering why and what's going on with that. When we look at meth, we know that the treatment for meth is unlike a lot of the other substances. It's much, much longer. Successful treatment for meth takes between a year and 2. Now, when you think of that and you think of your taxpayer dollars going for treatment, that's a lot of money. And the state can't do that. We don't have enough funding to be able to provide treatment and aftercare for 2 years for the people. We have to depend on the community to step forward and provide some innovative kinds of programs. So we know that it's also not only longer, it's more intensive. It requires a much greater contact with the professionals, a greater accountability, much more intense. And as I said, we know it's much more expensive. It's the most expensive treatment of any kind of substance abuse, meth is. When we look at that coupled with mental illness, and that's the other area that health and welfare is involved in, more than 50% of the people with a serious and persistent mental illness also are addicted to drugs or alcohol. 60% of the people in our state hospitals, and we have 2 state hospitals, one in Orofino and one in southern Idaho, 60% of the people that are in those hospitals have what we call a co-occurring disorder, both mental illness and a substance abuse. So if you can imagine what it's like to try to recover from both, not just one, but both, they're battling a double whammy, you might say. Every single day of their lives they're struggling with either a mental illness or a substance abuse. When we look at people who have gone through treatment, and we can look at a survey that was done in this last year, and I think these are kind of significant numbers. 52% of the adults, when we look at when they were admitted and when they were discharged for treatment, in the last 30 days of their treatment, 52% of the adults used their substance. So they were still in treatment in the last 30 days. 60% improved in the adolescents, so there was less use by the kids. With both adults and adolescents, 5% at the end of their treatment it increased their enrollment in school or found jobs. So that's good. We saw an increase in people getting jobs and going to school. This is important, I think. For adults, there was an 87% reduction in criminal justice involvement with adults and an 80% with adolescents. So what that shows us, when people are in treatment, when they're accountable, when they have somebody there that they know they can count on and who they're accountable to, they're going to do much better. And obviously, if they're in a correctional facility, they're going to, that's going to help. When they get out and they're in an aftercare and continuing into a mentoring kind of program, they still need that accountability. They still need that person that they know is going to ask them, how'd it go today? How are you feeling? What's hard? How are you coping? What are you doing about it? And those are the kinds of things that need to keep going, and that can only come from a one-to-one relationship. And that's what you're all here about, is to learn how we can continue to help people. So what happens when folks are in treatment or in the prison system for a long time? What happens to their children? Where do they go? Let me tell you a little bit about foster care, because that's one of the largest, most impactful programs that health and welfare is involved in. Just a little bit of numbers. Over the last 5 years, we've seen an increase of 49% of children in foster care in the state of Idaho. In any one year, or I should say actually last year, because it did go up a little bit, we served 3,335 children in the foster care system. That's a lot of children. On any one day, we may have upwards of 1,500 children living outside of their own home. Many times they're living with a relative, but many times there aren't. So often there isn't a relative that can provide a safe and caring home. And so in that case, that's when the children go to live with somebody else, a stranger. often when children are removed from a family, there's more than one child. So we're talking about a whole family that gets placed. We try very hard to place all those children together into one family because that's really important, obviously. That isn't always the case. Sometimes the children need to be split up, have to be split up, because we just don't have enough foster care homes, or if we do have the foster care homes, they can't handle perhaps a teenage boy and a little girl.